Hi everyone, I'm here today again. I want to talk about panic attack or panic disorder. But before I go further, please kindly like, share, and follow my page. Panic attack or panic disorder is a type of anxiety disorder, and is also a type of mental illness. So panic attack can be defined as a sudden unreasonable feelings that is characterized by raising heartbeat, as in the person will be feeling heart attack. The person, there is difficulty in breathing, there is sweating, and is usually affects all types of, as in all age. It does not have a particular set of people. Prevalence, the prevalence is that everybody, even including children, but it is said that people that are more prone to develop panic attack are teenagers or young adults, but it affects everybody, even children. And again, they say gender too, as in they say female are more prone to develop panic attack than male gender. And the causes is if there is family history of anxiety disorder, this person can can be prone to have panic attack. If there is mental health issue, so maybe the person have issue of depression in the family history of it, this person can be prone to have it. And again, if there is substance abuse problem, maybe the person take a lot of alcohol and other type of substances, this person can be prone to have a panic attack. And what are the signs and what are the things you say that this person is having panic attack? Is that you say that this person usually, they may have chest pain, they may have raising heartbeat, as in the heart can start beating very fast, they may have palpitation, they may be chills, there may be fear, trembling, you see them having difficulty in breathing, you see them having choking, they may be choking, they may not be able to, they will not feel comfortable within them, there may be nausea, there may be fear of losing control over situations, and you see them easily pissed off with things, as in in that period they may even lose concentration. So what is the diagnosis of panic attack? If you go and see your physician or your healthcare provider, what is the things that they're going to do to be able to satisfy that this person who is having a panic attack? Is that through your signs and symptoms, as through taking detailed history, history taken from the clients, you can be able to draw your conclusion, and other tests too can be done to be able to rule it out that this person is having it or is not having it. And the treatment is that it involves psychotherapy by going for counseling and medication. The medication depends on your consultant. He will determine the type of medication to give you. And again, after then the prevention is just like, for you to not to have this type of problem, especially for those ones that have this type of history of, maybe they have mental illness issue in their lineage, or somebody that abused alcohol very well, or someone that have history of anxiety before it will then progress further to become panic attack or panic disorder, you should cut down on your caffeine, as in your Nescafe intake. Anything you are taking that contain caffeine, you should cut down on it. If you are the type that like taking a lot of caffeine, you should reduce it, or should stop it, or you quit it. And again, you should eat healthy meal, as a balanced diet. Take a lot of water, and take a lot of food that is rich in vitamins and other minerals and other classes of food. And you should try to be able to manage stress. You should be able to manage stress. Don't let stress weigh you down. You should exercise the way you can, and again, you should seek help where you know that is necessary, where you know that this thing is becoming, or you notice that you are having it, or you are not feeling comfortable within you, or you know that when you are faced with certain issues, you are prone to have this attack or disorder. You should try to seek help from your healthcare provider, and you should try to let people know what you are going through, as in your close friends or your family. Talk to somebody, talk to people, don't keep it to yourself. You should feel free with people around you. At least there will be somebody that you confide in, that you can discuss what you are going through. Explain to the person. If the person cannot handle the issue, please try to go and see your consultant. And the complication of this disorder is that it can lead to anticipatory anxiety, and can lead to phobia. Phobia as in somebody the person will be afraid of certain things, maybe afraid of heights, afraid of water, afraid of animals. So it can lead to phobia if not properly catered for. So the outcome of this disorder is that, or conclusion is that, this disorder has cure. It can be managed. The thing is just that you should try and reach out when you notice that you are having fear that is that is too extreme, that cannot be controlled, that any little things you lose focus, any little thing you feel like choking, any little thing you feel like heart attack, any little thing you feel afraid extremely, you cannot handle situation, cannot handle stress, you cannot handle challenges. You should try to seek help for your healthcare provider, and you should try to eat well, and try to cut down on your caffeine intake. And if you are the type you are using drugs, maybe you are taking alcohol, another type of drug, try to stop it, or you cut down on it, so that you'll be able to live a very fulfilled and free from fear life, and you'll be able to live a life full of life, and enjoying it to the fullest. So at this point, I'm going to bring the talk to an end. Please don't forget, kindly like, share, and follow my page. And you can also get in touch with me on my YouTube page on Ibitoye Oluwakemi, or Oluwakemi Ibitoye. So thanks very much. Do have a nice day.